Dermot and obviously with Kilty Clogher. Thank you everybody in Kilty Clogher associated with the McDermott Summer School for inviting me to speak. I'm conscious of time, so I'm going to move on. And what I want to talk about today, as Regina said, is public policy making, just to see where we are, where we're going, and where obviously we need to go. Let's roll on 104 years from 1916. We now find ourselves in the throes of a major health emergency with the COVID-19 pandemic. We also find ourselves in the middle of the formation of a new government, now nearly 120 days since our general election on February the 8th. Like many of our European neighbours, it looks more likely that we will have a coalition government ruling this country for the next several years. Nothing strange in that. It's to Europe and the wider world that we look for a lot of things, and we've looked to best practice in relation to the fight against COVID-19 in some European countries. As we know, Italy suffered quite a lot on COVID-19. But I think really from the point of view of when we look to Europe and we look maybe to best practice, we saw what worked and we saw what didn't work in the early days of lockdown. And thankfully, this informed type of policy making saved the lives of most of our citizens, despite the tragic deaths of nearly 1,700 people. It's also to Europe that any incoming administration needs to look not only for the obvious financial aid that we need to reboot our economy and reboot our society, but in order that we spend that money wisely, we need to make sure that policy and policy making is well informed. Predictably, the general election in February was won and lost on growing concern and frustration with health, housing, and the broader body politic. As politicians always do at election time, the easy solutions of throwing money at the problem were offered to the electorate. What was lacking was a commitment to reform a dysfunctional system of governance in many ways and finding long-term solutions to many of the pressing problems facing Irish society. Serious issues such as aversion to change, powerful vested interests, mass bureaucracy, and little or no accountability within our system of public administration has been a contributory factor to a litany of bad planning and policy making in our country. A lack of political will to tackle these issues has directly contributed to a litany, again, of costly, inefficient, and coordinated services. Health, which I'll talk about later, is a fantastic example. If we look at the whole area of bad policy and vested interests, we obviously, as I say, healthcare in this country is the best case study that we can present. Let's look at the insurance industry. We can see straight away bad policy and powerful interest groups across this country have contributed on a daily basis to the struggle faced by many families across Ireland. Irrespective of whatever government is formed in the coming weeks or months, I think the challenge will be, in the words of former Taoiseach Michael McDowell, when he said that we need to become radical or redundant. I really wish any incoming government well, but in the unpredictable and uncertain climate facing our nation, political courage to take tough decisions is needed now more than ever. In the fight against COVID, what we have witnessed over the past months is a series of policy initiatives by our government, successful policy initiatives that were based on sound advice from a series of public health specialists and medical experts. Alongside this, our country witnessed a broad buy-in from all sections of society, which ensured that we didn't suffer the same fate, most notably the level of deaths, as many of our near neighbours. As a society, over the past several months, we also have come together to work together, and this new level of social solidarity has brought us out, or nearly out, of a major threat to our own health and welfare and that of our families. And getting us there, our government and those people who contributed to policy need to be applauded, as do our friends and neighbours and family members who have worked on the front line, treating our sick, cleaning our hospitals, and keeping essential food supply lines open. As we now look to the future, we need to continue what we started by developing policy based on evidence and best practice, because it's this type of policy making that works and has worked. What the last 10 weeks has shown is that informed data, real evidence is the way to make policy, not short-term political opportunism, and that is the only way forward for us as a nation as we face an uncertain economic future. When done well and with proper input, policy can indeed be transformative. One of the greatest pieces of Irish social policy enacted since independence was the introduction of free second-level education in 1967. This came about following a 1962 review of the Irish education system in cooperation with the Organisation of European Cooperation and Development, the OECD, and driven by a fantastic Taoiseach, Sean Lamass. Nearly 60 years later, this piece of social policy that we now take for granted is a testament to the power of information and evidence in order to drive real positive social change. Free secondary education transformed us all and created opportunities for the children of Ireland and for future generations. No longer would we go to foreign lands and doff our caps to the so-called well-educated. My late mother, then a young Josie Reynolds from Cremungan outside Drumshanbo, was one of those immigrants. She never saw second-level education, like many other people in Leitrim and across Ireland. She went to England, she trained as a nurse because she didn't have the money to attend secondary education here in Ireland. She wasn't an economist, she wasn't a sociologist, but she, like many of her generation, were very hard-working and astute. Her analysis of the Ireland of her childhood as a result of bad policy making was simple. She often said, those with brains had no money, and those with money had no brains. Believe it or not, this fantastic initiative of free education was actually opposed by elements within the Department of Education. Opposition from within the system to policy change was not new in Ireland, and health is certainly the best example of this. When our near neighbours in Britain were introducing the National Health Service just after the Second World War, it was resisted in Ireland by our vested interest groups, most notably the medical profession, who would lose income. Some things never change. The Catholic Church, who saw a type of socialised medicine as akin to the red tinges of socialism and communism. And last but not least, the Department of Finance, my old employers, who as usual played the cost affordability card. Like before, they knew the price of everything, but the value of nothing. When Britain was getting a one-tier health system, we enshrined our own unique two-tier system as part of our health policy. While we now claim to have a national approach to healthcare with the formation of the HSE back in 2005, we still have a hodgepodge and patchwork quilt level of services to this day. Local fiefdoms and egos remain dominant. In terms of systems, this is the worst of all worlds, both private and public. Sustained underinvestment in the public system created a lucrative private system. And now we see, with an aging population and an increasing population hitting 5 million, our public system is now buying care from the private system and from outside the state through our National Treatment Purchase Fund. We have consultants paid by the state using public resources for private work and all sorts of other weird and wonderful arrangements. That's like me. I often tell my students, going into my college tomorrow and using the college and the college facilities and lecture theatres and laboratories to teach private classes, and the students would pay me directly. It's simply absurd, it's nonsensical, and has no place in any society. Why haven't we seen a health system like that of Germany or France or other European neighbours? The answer is simple. When times get tough, we cut back on capital investment, which has resulted in sustained underinvestment in our services. But we've also seen that even when we had money, and this is something that we need to examine, all stakeholders, including those represented by Phil Hay, who I was listening to earlier. If we look at what we spend on our capital spend, even when our spend boomed from 3 billion in 1994 to 13.5 billion in 2016, the capital spend never exceeded over 6%. Now, what does that tell us? Because it all went on pay. From 1996 to 2001, 65% of all increases went on pay, and our workforce increased by 18% in the health service. It's not an accident that Ireland ranks in the bottom third internationally in many of the health outcomes and performance indicators used by the OECD. It's not an accident that we have some of the most expensive hospitals in the OECD, most notably our proposed National Children's Hospital. It's not an accident that we rank in the bottom third of the countries for the number of doctors, nurses, and hospital beds. It's not an accident that we produce the highest level of medical graduates, but also rank fourth in the number of foreign-based doctors that we have to rely on to work in our hospitals. It's simply bad policy in a deeply flawed system. If we hadn't listened to the vested interest groups in the 1940s and had a one-tier system, we surely would have better outcomes for all our citizens. 80 years, and we know Sláinte Care is now the approved policy of government and incoming governments through the All-Party Committee on Health, and I commend them for all the work they did. But we did it 80 years later. And full implementation is not going to kick in till about, we reckon, 2028. That's assuming we have the money for it. Despite the Trojan work of many of our health and social care services, one area where we fell short was the care of older persons in both public and private congregated settings in nursing homes during COVID. Analysis shows us that the nursing home crisis is a result of decades of policy mistakes by the Department of Health. Like in other areas of health, in social care, in childcare, privatisation was pursued relentlessly. And this was totally disconnected from the wider public health system. I have no problem whatsoever with privatisation. But we have got to have that debate in many respects on where we need to go, what type of mixed service society we need. We have, in relation to policy, we've got to go along and start in a partnership model, which I'll talk about later, examining where we're at. Despite witnessing the susceptibility of elder people in congregating settings across Europe to COVID-19, the lack of governance and connectivity was all too apparent in many private settings. What we saw from the various state agencies called to account in recent weeks was the predictable pass the parcel blame game. Instead of passing the parcel, we now need to start joining the dots. We need proper governance, we need coordination with care standards and efficiency as the hallmarks of our service model. Let's learn from our mistakes and move on. Let's not be moaning and groaning on what happened. Let's just move on. Older people are not going away anytime soon. In fact, they're growing in large numbers. Let me give you a few statistics. In 10 years' time, we will have 1 million people in this country over 65 years of age. We will add roughly 20,000 people over 75 years of age every year for the next 20 years. And we're all going to be one of them, or those of our loved ones are going to be one of them. So these people will need hospitals, they'll need primary care centres, and they'll need the full suite of increasingly expensive medical technologies. It's essential now that we devise real policy based on evidence-based practice from other jurisdictions when we look at health, social care, and more especially the needs of the elderly. Let's remember that one of the reasons why we did what we did in the height of COVID was that we examined what worked well and, as I said earlier, what didn't work in other countries. Let's start doing the same now with health and social care policy. Let's look at best practice. What does best practice tell us? Best practice tells us that integrated care is the way forward. It's where older persons with long-term care needs will have a single point of contact, a case manager, who will help older persons to access services when needed. It's about a multidisciplinary community approach that provides a one-stop shop for care coordination. Don't be shoving people from Billy to Jack and back inefficiently. It's about supporting older persons to live in their own homes, in their own communities, by providing timely access to health and social care that allows older persons to receive the right level of care in an appropriate location, ideally, as I say, at primary care level, not in the hospital-centric model that we have. It's no coincidence that our hospitals are clogged up year in, year out, day in, day out. At present, there are, as we know, and we all know this, at present we know that there are many health and social care professionals in the community supporting the needs of older people. But their capacity to deliver good service to the older population differs significantly. And it depends on a lot of factors, mostly historical and mostly linked to lack of resources. As usual, in HSE land, we have the usual, what I would call the hodgepodge of different services based on what we term postcode lottery. The service you get depends on where you live. That's not right. Let's look at the good stuff for a minute. At last, the HSE has recognised the pressing needs to have a system of properly resourced care through the integrated care programme for older persons, who now have 14 pilot sites across Ireland. Prior to this, there was no specific structure that enabled a cohesive team-based approach to the health and social care needs of older people. Information and communications technology, which is central to any system of health and social care. Investment in information technology is a priority. In community-based services with limited capability, how many times have you seen what we would call the sticky labels? people going around with files under their arms. This is the 21st century. We need to coordinate systems. We need investment. And the integrated care program for older people will bring that about if it is resourced properly. In Ireland, as in many other countries, we're living longer and better lives. This means that we have to make changes now to ensure we can provide well-planned, coordinated care for older people when and where they need it. Evidence-based practice and all of this integrated care program is based on evidence. It's based on best practice internationally. This model works. The implementation, though, could be a problem, and this is where we need to bring all stakeholders in. The implementation of integrated care is significantly dependent on new community-based multidisciplinary roles that have already been implemented, as I say, in other jurisdictions. And it needs also changed work practices. What I would say basically is that professional egos and empires based on old-fashioned reverence and deference and cap tipping, they'll need to be things of the past and left outside the door. The only thing that will prevent integrated care, this proven and efficient system of care, is lack of courage to reform our health and social care delivery model. And most of all, our inability to tackle our old friends' vested interests. As a public policy analyst and lecturer, I still often refer to Professor Joe Lee's superb book, Irish Politics and Society, 1912 to 1985. Definitely a great read. I met Joe in New York a few years ago. He works in New York University with one of my American cousins, and we discussed how many things had changed in Ireland since the publication of his book 35 years ago. But most of all, how many things remain the same. And we had a good laugh and we joked and the whole lot, but it's not a joke. And I'll just quote one piece from Joe's book, if you'd allow me. On page 546, he talks about interest groups, and he says, interest groups play an indispensable role in modern society. Their influence, however, has been increasingly exerted against the national interest, as the more muscular have sought to force others to pay for their winnings. The failure of the political parties to resist their most avaricious demands has damaged the country's competitiveness. It has blighted the prospects of a younger generation and fostered a cynicism that has further corroded the sense of the public interest. Some things never change. Not even the Troika could reform some of the working practices and the fiefdoms of law and medicine 10 years ago. Now, more than ever, considering what we have come through as a nation, maybe the realities of how we'll have to live our lives in the coming years will make us have a rethink on what's really important to us. The obvious direction of any new administration is a commitment to the enactment of what I would call a European-style social partnership model of policymaking. This system has contributed significantly to economic and social stability seen in the jurisdictions of many of our European neighbours. Unfortunately, social partnership is a bad word in Ireland because our brief experiment with social partnership in the good old Celtic Tiger years didn't follow any European model, just an Irish model. Instead of offering wage moderation like our European neighbours were doing, what we did was we offered wage moderation in exchange for tax cuts. So a properly constituted social partnership system would be populated by government, by obviously interest groups, business interests, farming organisations, trade unions, but most of all as well by civil society groups. And they need to follow the lead of their European counterparts and act in a socially responsible way. Not what went on in the past, where members' interests were first and society's interests were second. A measure of the health and of our own body politic is an indicator of whether our society is capable of rationally debating issues with a view to finding common purpose. Across many European countries, a collectivist culture exists where all members confront the realities of the marketplace and the wider problems facing their own particular societies. European-style social partnership focuses on the need to create a socially decent society where a rational and evidence-based approach is taken to finding solutions to the pressing issues of the day. Just, in fact, what we did over the last 10 weeks successfully in this country. Mutual respect is the hallmark of such an arrangement, with objective economic and social research facilitating this process. A new model of social partnership would enable issues such as private and public sector pay to be determined by an independent body and not by sectional interests, whose main aim is to copper fasten existing paying conditions. Already, we've had calls from trade union leaders in the last couple of weeks to ensure that pay awards due next October to public servants like myself should be paid. Maybe they should. I'd love them. Maybe they should, given the Trojan work carried out by our health and social care professionals, our Gardaí and other emergency services. But neither should anyone in a position of responsibility in this country forget about the hundreds of thousands of workers in precarious working conditions. That's even if they have work. They manned our supermarkets, they manned our warehouses in the middle of a crisis to ensure we had a food supply as a nation. Let's not forget our cleaners who constantly risk their lives to keep our hospitals and workplaces open. If we're to look to Europe, let's not also forget that Europe's economic growth is based on what we would call the prevailing social contract that offers wage moderation in exchange for the construction of a welfare state with this associated tax requirements accepted as part of the package. The choice for Ireland is to decide on finding the appropriate balance of tax rates and the provision of effective public services. Put simply, we can't demand a European-style welfare state funded by US-style low tax rates. We can't have it both ways, no matter what we've been told. We can't. To conclude, as a nation, we're about to face major social and economic challenges. If we're to get through these, we need to look to Europe so we can provide real public policy solutions which can lessen the worst effects of impending change. As long-standing members of the European Union, let us start by examining evidence-based practice of wider European societies to find public policy solutions. If we go back to 1916 and Sean McDermott and his comrades, in the proclamation, they referred to looking to their gallant allies in Europe. It was the Germans at the time. We need to do this again, but in obviously a totally different context. To do this, political courage and maturity will be required by any new government, by opposition parties, but most of all, by the Irish people. Let's continue to show, as we have done over the past several months, that we're all in this together. Thank you for listening. And wherever you are in Ireland or throughout the world, please take care, stay safe. Gwera maith agat, túr ara.